The World Malaria Day, celebrated this year, is a sigh of relief with a breakthrough on malaria vaccine that has provided a glimmer of hope in the malaria response. But the right to quality, timely and affordable services to prevent, detect and treat malaria is still not a reality for many people. TVC News' Kemi Balogun has details.
This community in the Buari area of the Federal Capital Territory, like many others, has its own fair share of the residents being infected by malaria. Juma Unisa is here to get herself checked. She tells us about her experiences during all her pregnancies and the way she stays protected against the disease.
When you prepare for that time, before going to antenatal, you make sure you have something in your hand to collect drugs. And in that antenatal, they have to give you drugs, both malaria and other drugs. That is why I used to treat it.
Pregnant women as well as children under the age of 5 are mostly affected, but disparities, which is both financial and otherwise, continue to put them more at risk. This outreach has been organized to give out malaria tests, preventive malaria medicines and other medical checks that may be needed in order to reduce these risks.
Test and treat for those that are positive and at the same time educate them on prevention.
The rural areas are the people that need this outreach the most, because these are the people that sometimes they will not even have the money to go to some of the hospitals.
According to data from the World Health Organization, Nigeria accounts for nearly 27% of the global malaria burden and 31% of malaria deaths. Children under the age of 5 are most vulnerable, accounting for more than 65% of all malaria deaths, and pregnant women are particularly at higher risk of contracting the disease due to their reduced immunity. This year's theme hopes to focus on the need to close the gap in the inequalities that exist in malaria prevention, detection and treatment.
Children and pregnant women in particular should be given prophylaxis against malaria within the endemic months of malaria, which is about May to October every year.
Seizures and difficulty in breathing. Experts insist that identifying the signs and symptoms of malaria is necessary for timely diagnosis and treatment. Kemi Balogun, TVC News, Abuja.